Hi, and welcome to The Holistic Entrepreneur, where we explore innovative approaches to healthcare through conversations with pioneering practitioners. I'm your host, Zane Myers. Let's dive into today's episode.
So she had another nurse come over and draw her labs. And, one of our providers met with her, and sure enough, she had really severe iron deficiency anemia. And we were able to do, I think, 5 infusions for her. And it was night and day. Just you could even just see it in, her personality, her interactions, with you, just, going from feeling exhausted and like she couldn't even take care of her kids to excited about the job. And obviously that just reignited her passion for what we're doing and helping other people with these kind of things. Yeah, she's still working in the ER and she's still working for us. She's actually one of our team leads now and does a great job. And so huge impact on her life. And, I think that's always really fun when we can help, our own, nurses and people that work for us. So that one always sticks out to me.
Okay, so I am here with Ryder Olsen, and he is one of the founders of Modwella, and we're going to dig into all about Modwella and then find out about you as well and your path to getting to where you are now. And Modwella went from looks like nothing to now being like a success story. Pretty remarkable success story. So it's really an interesting trip. So tell me about, I guess I want to kind of lay the background here as to how you got to where you are now. I mean, what led you into, just to give a little bit of background, you were in the military before you started this, but what led you into the military and
Yeah. So, honestly, the military was always something I wanted to do. In college, I played baseball and I liked kind of that team aspect. And once I decided to go into medicine, it just kind of made sense to do something I always wanted to serve. Nobody in my family was in the military, so I didn't kind of have that background. But honestly, I thought it'd be a great way to pay for school and something exciting and kind of get that team feel. So my military experience was amazing. It was a great fit. I wanted to do emergency medicine, so there's no better place to train than in the Army for that. So yeah, after residency in Texas, I served 4 years at Fort Lewis McChord in Washington, and did all kind of my payback time there. I deployed to Iraq in 2018, and overall it was just a great experience. And I'm so glad that I did it, and it kind of led me down this path as I was getting out of the military. My now partner, and he's actually my cousin, was a nurse and kind of brought this idea of like IV therapy in people's homes, and it was kind of a new thing back then. And it just it kind of made sense.
and your experience over there. I think that's where we kind of tailed off there for a minute.
Yeah. So as far as the deployment, I deployed to Iraq. It was a great experience professionally, and was able to kind of really. It was right after residency, so it allowed me to kind of fine tune some of my skills from a trauma standpoint, and overall just really rewarding experience in the military. Kind of led me to this, getting out of the military, my GI Bill, wanted to do an MBA, and this kind of opportunity to step into the entrepreneurial world kind of opened up for me, and was able to go into business with my cousin, who's a nurse, and then also my wife, who really always had an interest in health from her own personal struggles. And we really were looking for an opportunity to connect with people in our local community initially. We just thought, well, let's do something cool for our community. Not only creating an amazing job for a nurse, something outside the box and outside the system, and also clients, and just really bringing professional healthcare to their home. And that was kind of our initial mission, was let's connect with people. This was during COVID, and there was a lot of separation from that connection, especially from like a caregiver standpoint. It was just really lost during that time. And so that allowed us to bring it back and take the care into people's homes where a lot of it was happening anyway, because people weren't, out and about. And, it really made a lot of sense at the time.
So a lot of places, a lot of individual practices were struggling during that time, and because you had kind of a different approach, it was a perfect fit for your approach. So tell me, when you first got started, like the first, so your cousin comes to you and says, "Hey, Ryder, I think we should do this. This is a great idea." And you said, "Okay, let's do it." And then from let's do it to actually doing it. Who was your first customer? I mean, not their name or anything, obviously, but how did it transpire to get your first, customer, I guess is right, but patient?
Yeah. Yeah. Well, I would say at first it was just a lot of family and friends. It was like, at the time in Utah, there was like one other company doing in-home IV therapy. And so to get it rolling, it was just, kind of that guerrilla marketing and just telling everybody we could about what we were doing and how we were doing it. We launched in April of 2021. It took us about 6 to 8 months to put everything together. There wasn't a lot of great information or a roadmap out there because this was a new industry, and we really wanted to take an approach of that connection with the client and nurse, and more of a long-term approach versus, like, at the time there was like, the buses in Vegas and, more of this IV therapy being about hangovers and that kind of thing. And
Mm-hmm.
we really wanted to make it more professional and medical, and address a lot of different issues for people. So yeah, it was just kind of getting the word out. We really weren't doing a lot of marketing initially from like a digital marketing standpoint, and just word of mouth and referrals and trying to deliver good care. There was a lot of barriers in terms of trust. It was outside of what people typically knew. If you have a migraine or if you're pregnant and vomiting, it's like, can someone come to my house? And who is this person? Are they qualified? That kind of thing. So we really had to gain a lot of trust in order to get the ball rolling. And it just kind of naturally grew from there. Nurses who were having a good experience or telling their friends. And, at the time, people were just looking for something outside the box.
So a typical patient now for you mentioned a couple of you're talking about pregnant women, and they obviously get sick. Anyone who's had a pregnant wife knows all about that, and the pregnant wives, they also know about that. So it's pretty well known. But really never thought. I just thought, okay, well, not to sound insensitive, but just deal with it. So instead, instead of just dealing with it, you are actually dealing with it from a clinical aspect to make somebody feel better. So how does that work? So let's say I'm a pregnant woman and I'm just not. I feel terrible. Feel like crap. I'm nauseous. And then what's the typical treatment that you'd come in and bring to bear?
Yeah, it's actually quite simple. With pregnant women and vomiting, it's really just fluids and Zofran, an antiemetic, and so it can go a long ways. It sounds, it's really nothing fancy, and the real problem is like, let's say a pregnant woman and she's got another kid at home, and she calls the OB office and said, "Hey, I just can't stop vomiting. I've been sick for a few days," which is pretty common in the first trimester. And most places would just recommend they go to the ER to get some fluids and some Zofran and kind of get on top of things. And so obviously that could be a challenge for those women. And so, yeah, we just make it convenient. We go to them. It's all in home, and we can administer fluids and antiemetics to help their nausea. and hopefully get their appetite back and get them feeling better.
So what would be some of the other applications where do you guys do do you do pick placements or things like that, or is that a totally separate?
Yeah, no, we don't do any like beyond just peripheral IVs.
Mm-hmm.
We don't do anything like that. But I would say our typical clientele. We mentioned pregnant women with vomiting, migraines, GI illnesses, viral illnesses, COVID, flu. We deal with a lot of autoimmune conditions. That people are struggling with. People are using us for anti-aging infusions. We have an iron infusion, so people with iron deficiency anemia, that can be a really challenging one to get insurance to pay for, unless you're really, really severe. And the infusion centers tend to be really expensive. So we're able to take care of those people, and there's actually quite a few out there. And so our service has been, great for them to get their iron infusions at home and make it convenient.
Yeah, I remember my daughter. This goes back a long ways. She had an iron deficiency, and she was like, this is many years ago, but she was around 17, and her hair starts coming out
Yeah,
because she didn't have ferritin, which was
right.
specific, as a specific kind of iron, and couldn't they didn't diagnose it properly, but just getting insurance to cover it was strangely difficult.
Yeah, yeah, and I mean they can be quite severe, like you said, and the insurance companies, have set the bar, so high to get approved that most people are very symptomatic, definitely affecting their day to day, and they're not able to get their insurance to cover it, which that's kind of a whole different story as far as insurance companies and covering things. But that was part of our motivation, is to get it to an affordable price where someone who's really struggling uh, can use us and get the treatment they need. And with iron deficiency anemia specifically, it's really challenging because it's hard to supplement orally. It's just not absorbed well. People tend to not feel, it has a lot of like GI discomfort associated with it, and this really helps them get feeling better quite a bit faster and repleting their ferritin levels.
So, with the iron deficiency, that's something that is just can't be. You can't just go in and say, "Okay, here's your IV, you're good. We'll see you in a couple of years." This is like an ongoing therapy that they need. Isn't that right?
Yeah, that's correct. And we utilize our lab service. So we have a lab service, same thing, all in home. So a nurse will come to your home, draw your labs, take them to the lab, get them processed. Then our provider follows up and goes through those really in-depth analysis of the labs. Not the typical just like, hey, your labs are normal, and move on. We really like to go through each lab that we drew, why we drew it, what it means, and try to educate our clients as best we can, and I'll also provide them a copy. I don't know if you've ever tried to get like records from your doctor, but it can be pretty challenging. So we want all that to be very easy and convenient. But then, we can determine, yeah, you are a great candidate for iron deficiency. We want to do everything safe and up to the standards that you would have in a hospital or clinic. And once that determination is made by our providers, then a nurse will go back out and they'll have the whole treatment plan laid out. Because like you said, it usually requires multiple infusions. Most of our clients are getting like 4 to 5 infusions over a span of 3 or 4 months, and then we can kind of do the labs again, see that there's been improvement, and then make determinations from there. So it's one of my favorite services because it was really kind of a pain point for these clients, specifically because they just didn't have great options, and they do feel horrible. They really are affected by this in a way that they almost can't function.
So, tell me about somebody in particular that you can think of. Obviously, patient information omitted, but tell me about somebody who had this iron deficiency, and it's best like an individual story, because then people can kind of understand, and maybe they can even put themselves into the situation and say, you know what, I wonder if I have that. Tell me about somebody that that was having these symptoms and maybe didn't know what it was, and then you guys came in and diagnosed it, and then got them on the iron, and then what happened?
Yeah. Probably our best success story from an iron standpoint is actually one of our nurses. So she was really struggling. She had 3 kids over the span of 4 or 5 years, and just gradually just was like a lot of fatigue, just like generalized weakness. She was feeling short of breath. She really was to the point where she, was debating whether or not to even continue being a nurse, because she just didn't have the energy to do it. She was an emergency room nurse, and working for us, and had been with us for a while. And eventually we just got to the point where she's like, I just need to see what's going on. So she had another nurse come over and draw her labs. And, one of our providers met with her, and sure enough, she had really severe iron deficiency anemia. And we were able to do, I think, 5 infusions for her. And it was night and day. Just, you could even just see it in, her personality, her interactions, with you, just, going from feeling exhausted and like she couldn't even take care of her kids to, excited about the job. And obviously that just reignited her passion for what we're doing, and helping other people with these kind of things. But yeah, she's still working in the ER, and she's still working for us. She's actually one of our team leads now, and does a great job. And so huge impact on her life. And, I think that's always really fun when we can help, our own, nurses and people that work for us. And so that one always sticks out to me. So.
Yeah, that's a great story. That is a great story. So how often does this kind of thing go undiagnosed?
I think that it's I don't know how often it goes undiagnosed, but I think that the symptoms tend to be quite vague in the beginning. We've all had those times where we're like, man, I'm not feeling quite as sharp. I don't have the energy that I feel like I should have, and I think it takes a while to really get down to the bottom of it. Obviously it's something that we're kind of tuned into. We deal with a lot of women. The majority of our clients are women. And so, these are some of the things that we're looking for. People are seeking us out because they don't feel well, and maybe they're not getting the answers that, they want from their doctor, or they really want to take a deeper dive. So we do a lot of hormone in general. And then this is another one that we will find quite often. So it's a fairly common problem, especially in childbearing women, just because postpartum, it tends to be an issue. And I think that because insurance doesn't pay for it, a lot of times it's kind of like, oh yeah, you're deficient in iron, you're a little anemic. Here's some ferritin, supplements to take, and hopefully you get feeling better. And what we find is that a lot of people don't get feeling better, and they're not really tolerating the medicine, so they tend to not to take it because it makes them nauseous and those kind of things.
Yeah, isn't there a lot of stomach upset with associated with iron, oral iron supplements?
Yep. Yeah, exactly. And so, just like anything, if you're taking something and it makes you feel horrible, like, you just slowly stop taking it, because you're like, yeah, this doesn't seem to be making me any better. And it really does take a really long time, if ever, that they get their ferritin stores up to where, they need to be in that normal range. And so, yeah, we're definitely seeing it. And it kind of fits our clientele, and people that are seeking us out to figure out how they can feel better. And, a lot of people that utilize our service are just looking to optimize, men and women. It's like, I want to try to make the best version of myself and feel better and take advantage of the different, supplements and treatments that are out there that, don't kind of fall into that traditional healthcare realm.
So tell me about the anti-aging part of it, or actually about the supplement. Let's talk about the hormones first for
Okay.
for women. By the way, I just let my curiosity guide me when I'm having these, because it's like a conversation I want to know. So hopefully the people who are listening also are curious about the same subject. So if I go off in different directions, that's why. Maybe I'm ADD.
No, that's fine. Yeah. Hormone replacement has become, a really big thing lately with women, especially around like perimenopause and postmenopausal women. And it's really just finding a balance of hormones. The balance between estrogen and progesterone and testosterone is even important in women. And so it's really kind of a delicate process in repleting and diagnosing. It's a combination of a very like thorough history and deep dive into like the symptoms that they're having. So it becomes very personalized treatment. And so a lot of lab analysis, historical, as far as like what their symptoms are, and then putting those pieces together in order to come up with a really good treatment plan. And it ends up being a combination of those things. So, the balance of estrogen, progesterone, and testosterone, and making sure that kind of fine tuning that to fit the symptoms that they're having. And then just kind of continued analysis with labs and those kind of things. But usually we can get people back on track, within 3 to 6 months and feeling better, and the issues that they're having tend to be improved. We kind of do the same thing with men with testosterone. Testosterone kind of gets a bad rap, like, people think about bodybuilders and people kind of more abusing testosterone, but it can be a really great not only prevention, but also just optimization of men's health if done right. And again, that's where, we really try to safety first, make sure we have objective data to make decisions on. We're not interested in, kind of this pill mill, like everybody cookie cutter replacement. Everyone gets testosterone kind of a thing. Mm-hmm. We want to make sure people qualify. We want to make sure it's safe, monitoring things like their blood pressure and their PSA levels and their blood counts to make sure that, it's really more of an optimization. We don't want to get them too high because that's where all the side effects come in. And that's where the problems arrive. So we want it to be supplemented in a really safe range so people can feel better, and all those things that men kind of deal with it, as they get into their 40s and 50s. Right. A lot of those things can be very much improved by, just really low dose testosterone. We have another
ask you about prostate health and testosterone in the because I know you said PSA. Sorry, I have a little medical background, enough to make me know that I don't know a lot of answers.
Yeah.
The link there between if you do have a higher PSA,
mm-hmm.
it may mean absolutely nothing,
right?
But it kind of puts the kibosh on using the testosterone treatment for men without dealing with that issue. How do you balance that out? As men get older, a lot of them, their PSA goes up, even if they don't have cancer, they have just enlarged prostate. How do you manage that?
Yeah, and that's where we actually have to bring in someone's primary care because there are a few additional steps that we don't really dive into. So usually what we'll do is if their PSA is borderline and they're interested in testosterone replacement, we'll have them go do a manual check and say like, is this problematic? Or is this just an enlarged prostate and it's something that we need to closely monitor? we're usually checking those every 3 to 6 months. And
Mm-hmm.
so we're keeping a really close eye on it to see which direction it's going. And we tend to be able to have a good relationship with, people's primary care. A lot of them don't want to do the testosterone replacement. And so
Mm-hmm.
it kind of is a good match. And it really is the way it should be, in my opinion. It's like we aren't trying to replace traditional healthcare. Like the ER exists for a reason. It should be there. Oncologists, all these specialists that are out there, and including primary care, in my opinion, serve a really crucial role. Really, we want to be a supplement to that. We want to bring a value that is hard to do from their standpoint. So in this case, it tends to work out well. We can refer them back to their primary care. They can determine, yeah, this is just BPH. We're going to watch it close. Maybe start on a low dose and then recheck in 3 months. Which direction are we going? Are we staying the same? Are we getting dramatically worse? It's really just obviously prostate cancer is one of the most common cancers in men. So it's something that's watched closely, but a lot of times we're able to supplement in a more conservative fashion and get them some benefit from the testosterone therapy, but not affect their PSA levels or make their, BPH worse necessarily. So yeah, just something you have to watch close and be careful with. Sometimes people just aren't good candidates. It's just not safe, and
Right.
unfortunately, they can't take advantage of the therapy. So
let me ask this same sort of question about women. So my wife used to be on take specific hormones. And then she, heard some article or read some articles that said, hey, you're at greater risk of cervical cancer and all these other cancers, and you're going to die if you continue to stay on your hormone replacement. And so there was a lot of that. I don't know, in the last maybe I haven't heard as much in the last 3 or 4 years, but there was a lot of it over about a 10-year period that was talking about, particularly for women who were taking hormone therapy, that was actually worse than not doing it at all. I think there's been some change in the thought process over the last maybe 5 years or so. Can you speak to that? I mean, it's kind of a
yeah. I mean, I think in general, it's like most things in medicine. Whenever it's new, we don't really know. Like the science community is trying to do the research and keep up and figure out, like what are the true risks of these kind of things. And so, like you're saying, 10 years ago there was, some potential scares, and that you can look at a lot of different medicines and surgical procedures that kind of go through this phase of like, we're really unsure. We don't know. We just went through COVID, and there was a lot of things that we didn't fully understand, but the science community tries to catch up and get us the best literature we can, the best studies, so we can make the best decisions. And I think that hormone therapy is the same way. I think there was a lot of things that we didn't fully understand. Like I said, it's very delicate, and there's a fine balance to it. Too much testosterone, too much estrogen for a woman can be problematic and can potentially increase the likelihood of a cancer or malignancy. And so I think that it's one of those things that a lot of that has been debunked. We've fine-tuned, like the delivery is important, whether it's, are you taking oral? Are you doing an injection? Are you doing like intravaginal? Or creams, there's different delivery methods. And so what we've learned over time is the balance is important. The route is important, and making sure that you are taking into consideration all the potential risks. And that's where the history is so important. It's like, you really got to know their family history, their personal history. And then it's a very, I would say it's not like a one and done kind of thing. It's like you go to your doctor, you have high blood pressure, like here's your pill, and you kind of go on your way. This is more very close monitoring, especially in the first year, to make sure that not only are they clinically improving, but they're their labs are looking good and that they're not getting, too high in one area or the other. And so yeah, it's definitely a fine balance, but I would say overall we've gotten better at it. And that's like most things in medicine, just with time, we get better, we get more knowledgeable. And also the pharmacies, a lot of the compounding pharmacies that we use, they get better at the delivery and how we're giving it. And so, yeah, it's definitely one of those things that is kind of this up and coming idea, and a lot of women are benefiting from it, which is really cool to see because I don't know if you have ever experienced, women in this kind of time. It can be really challenging, the challenges with sleep, the challenges with just like night sweats and fatigue, all that kind of really hits them at this time during that perimenopause, and it can be really disruptive to their day-to-day life.
Mm-hmm.
So it's awesome to see when we can really come in and help someone feel better.
That is awesome. So let's talk about Modwella and the way you guys. So how long has Modwella been in business?
Yeah, so it's Modwella. The name is a little bit tricky.
Okay.
Yeah,
I didn't mean
Modwella.
to butcher your company name.
No, it's fine. And I'll kind of give you the background of the name and make a little more sense. So going way back, we actually were initially Revive. And this kind of goes into like business lessons learned, but we love the name Revive. We thought, this is a great name. And so that's what we went with initially. And come to find out, it's a very popular name in the medical community. And a lot of other people thought it was a great name. So from a marketing standpoint and those kind of things, it became more problematic. So at the time, we were just doing IVs, about our first year in business. And we're like, we really want to branch out. The second service that we added was labs. And that was like kind of the first step to get into these other services and modalities of treatment that we could offer. And so we like, this is a good time for us to pivot. And we really like the idea of modern wellness. And, how can we make this more up to date in a way that's convenient and easily accessible for anybody. And so that's how we kind of came up with Modwella, is this modern wellness. And so, over some time and a lot of pain, we kind of put that together and rebranded, which if you've ever had to go through that, it's pretty painful, but yeah, lesson learned, pick a good name that is unique, I guess. Yeah, so that's kind of where the name came from. It was like, our second year in business when we rebranded.
So so you started out was just you and your cousin, and then how long before you added somebody else?
Yeah, so initially when we started, we actually, so it was me and my cousin Jake. He was doing all the IV treatments, and I was obviously the overseeing provider and physician. And then my wife actually was doing she did our website. She did like all our initial brochures, and she had some background in business and was really interested in that. And really in the beginning, it was more about all of us doing something to fulfill, these different areas. My wife was really frustrated with the medical system, and she had Graves' disease and some autoimmune conditions. And so she was really interested in this space and some of the different therapies that were out there, and just the lack of connection, and to kind of put that into perspective, when I was deployed, she had 2 kids at home. She was pregnant. She was miserable, not feeling well. And she really experienced what, the system was lacking, and that's connection. She just was never able to really find someone that could put it all together for her. And so she was really passionate, and her degree is in public health. And so she had this background that was, really fit well. And then she actually had the skills to like develop a website and do some of the marketing stuff that Jake and I had no idea anything about. And Jake was actually a nurse at the prison at the time, and he had done a lot of different nursing jobs, ICU, and he just wasn't happy. He was looking for something more, and to really connect with people. I think that's kind of the common theme is we want to connect with our clients, and we want to make a long-term relationship. We want it to be that we see you, we see anyone in your family, we see your friends, and a lot of our clients will say, I have a nurse that's my nurse, and I'll lend her out, kind of a thing. They really like that relationship to have. And
it's very old school. I mean, it comes back.
Yeah.
I mean, it goes back to another century. Not
exactly
like even before the 20th century. It goes back to house calls and all of that. What you think of is what something you kind of longed for and wished. Oh, I wish a doctor could come to my house. And oh, that's ridiculous.
yeah, exactly. It really is taking it back, and I can only imagine what it was like to be a physician, 100 years ago, and going to people's homes and delivering their babies, and and all these kind of things that happened. And what a great relationship and connection. So yeah, I think we are taking it back, and that's what our nurses tell us. That's what they love about the job. They love going to people's homes, helping them feel better, making it convenient for them and fitting into their lives. Everyone is so busy now, and it's like the mom that has 3 kids, and it's like, how hard is it for her to put all her kids in the car, go to the doctor, or go to the ER, and these kind of things. It's like, it's not really ideal. And then if you get into like insurance and those kind of things, it's like, this is the price for us to come to your house and do this service, and that's it. There's no hidden fees. There's no, like, well, we'll see what the bill ends up being, the uncertainty of those kind of things. So the 3 of us really connected that way. Jake actually had MS, and so he had gone through his own struggles from a health standpoint, and his own struggles professionally. And I was just looking for something to do from an entrepreneurial standpoint. And I thought, man, we could really create a great service and a cool job for a nurse, and hopefully marry the two and have some success. We hired one nurse. It was actually a kind of a family friend who was excited. She was doing oncology, working at an infusion center at the time. And so the 4 of us started out, and it just kind of grew from there. And she's actually our CNO now, which I love that story, because she was the first one that believed in us, and really helped us grow the company. And she actually went to Arizona for a year and opened our Arizona branch, and then came back and is now the acting CNO. So we have a lot of family and friend connections, and a lot of nurses bring on other nurses that are friends, and it's really fun for them to kind of go and do events together and collaborate together, and just take care of people in a way that allows for them to do what they thought it was going to be. This is what people thought nursing was going to be, or just that really intimate connection, and being able to spend time. Like the nurses, a traditional like Myers cocktail, is 45 minutes to an hour. So they get they're a little busy in the beginning, getting the line started and giving the meds, but then they have, 15 to 20 minutes just to sit and chat. And I think that's also what's missing is, we really want to connect. And, when I'm in the ER, for instance, it's like, I'm lucky to spend 5 minutes with someone.
Right.
And it's like, tell me why you're here, and let's get the details quickly. And then, we're moving on. And it's not always, I often leave the ER thinking, man, I wish I could have spent more time with that person. I wish I could have sat with them and mourned the loss of their loved one or a bad diagnosis, but it's just not set up that way. Unfortunately, there's a lot of patients to see, and it's not always ideal. But I think that's where we can all connect as a group. We have over 200 nurses now, and over 10 providers that work, and that's where we all connect. Is like, hey, this is really satisfying because we're seeing the success stories, and we're seeing how the nurses are loving the work and the job, and it almost doesn't feel like a job to them, which is always the idea, right? And so yeah.
So that's really great. So we went straight from you, your wife, and your cousin, and one nurse to having 200 nurses. That didn't just happen. There's more to that story. I mean, that's it's fantastic. And kudos to you for you. Just administratively, that's a lot to chew off, and I imagine that you are a very busy person, but you must have really good people in place to keep your sanity. So tell me how you went from 4 people to 200. How did that happen?
Yeah, so I would say honestly, it's been a lot of just very natural growth. And because of my military background, and I moved around the country and met a lot of different people and made a lot of different connections, worked in a lot of different places, it kind of just naturally happened. I think because of the timing. I think one of those situations with COVID, it was just like the timing was right, and people were kind of burned out and looking for other things. And so I think there was a lot of natural growth that way. We really tried to stick to our mission, our values up front, and continue that. And I think that just allowed the nurses to have a good experience. And then, nurses tell other nurses, like, hey, this is a great job, you should check it out. And so through all those connections, we were able to expand into other states, and kind of partner up with some people that could help us grow it. We made some good decisions in the beginning about some core people that were passionate about it. I think that's really what it boils down to, is we all have the same goal and the same passion. And I think that just kind of, it spreads through the company. And, we have some great managers in place in every state that we're in that are kind of like, the all-star nurses that want to continue to grow their area and provide the service to their community and surrounding communities. And so yeah, I mean, I think it's also just become a popular option for, people out there. They're like, hey, like, this makes a lot of sense. I don't want to go sit in the ER for 2 hours and wait, and then, pay this huge bill.
And get 5 minutes with somebody.
Yeah, and not connect, right? And not feel listened to, and not feel like, they got much out of it, and so, yeah, we've been able to slowly add services, which I think has also supported our growth. Is when we made that pivot to like, hey, we don't want to just be an IV company that goes and give people, vitamins for hangovers. When it was really about long-term clients, additional services. We added the lab service, and then we added NAD infusions, iron infusions. We're doing weight loss now. We're doing hormone replacement. We do talks.
Tell me about the most frustrating things about your business.
I would say the biggest challenge is doing something medically outside the box. There's the business challenges that every business has, but then there's the medical challenges. So every state has its own set of laws of what can and can't be done from a medical standpoint, and especially outside of a hospital or clinic. So there's a lot of research that goes into making sure that we're protecting our licenses and doing everything up to par. So I would say that's one of the bigger challenges. And anytime you're doing something that's new and outside of the traditional way of doing it, you run into a lot of roadblocks. There's not a lot of great, you can't get on like, let's say we wanted to move into Nebraska tomorrow. It's like you can't just go find a clear outline of what you can and can't do. There's so much gray within this industry, and it's getting better. And certain states have really said, hey, like this isn't going away. Like this is something that people want, and we can do it the right way, and have given a lot of great guidance. But most states haven't. They're way behind on catching up, saying like, hey, this is legal, this isn't, in somebody's home, and how to do it. So we're operating in the gray with that, but we've just been really good about working with, the different boards, the pharmacy boards, the nursing boards, physician boards, and trying to get as much clarity as we can. And that's served us well, just to take initiative and be proactive about, hey, this is what we want to do, and we want to do it the right way. We're not trying to cut any corners. We, from the very beginning, I said, we're gonna have a legitimate medical business where we have a full EMR, we have provider oversight, everybody's a registered nurse. We only hire registered nurses that are licensed, that have all the, the proper training. And we put in a lot of energy into our training programs. But yeah, I would say that's the hardest thing. There's a lot of work that goes into kind of the beforehand, before we can say, okay, yeah, like these are the services we can do. And every, California, for instance, there's certain things we can't do in California that we do in every other state. And that's just because of the laws that are there, and the different, challenges that state brings in particular. But
for every kind of business.
Yeah. Oh yeah. Yeah. Medical and business. It's very challenging there, but the people there love this stuff, and so to us, that it was worth it to go through the pain of it. It took us forever, I think over a year, to work through all the legal side, but our business has done very well there now, and people in California love this kind of stuff. There's certain places that you just know that people want to take their health into their own hands, and we're a great match for those people, because they really want to take charge, and they want to be in the know and make decisions and be proactive. Our current system is very like treatment driven. You have this diagnosis and you get this treatment. But there's a lot of people out there that are kind of done with that and say, hey, like I want to be preventative. I want to be proactive about my health, and I want to take charge, and not only like feel good, but optimize my own body and make it the best it can be.
So give me one other example, because I always like the stories about somebody who had either wasn't aware of what they had going on, or I think people like to hear the stories about somebody who maybe was surprised by getting a particular treatment. And I talked to a lot of alternative care providers of all kinds, from integrated medicine providers, acupuncturists, physicians like yourself. And it's always interesting to hear when someone goes in and has a procedure or therapy done and didn't expect to have the outcome that they had happen.
Yeah. There's actually a really recent one that one of our Idaho clients, this guy actually had a pretty severe case of pulmonary fibrosis. And he was actually told by his pulmonologist that he needed a lung transplant. So it was very severe. Like his pulmonary function was declining at such a rapid rate that they were kind of at this point. And he had heard through a friend about NAD treatment, and then another infusion that we do that's called NAC. And
so
that can be really
give me the full name there instead of the initials, because people are not going to know what that is.
Yeah, so N-acetylcysteine is the NAC, and that one's specific for is great for lungs and to help kind of the repair that needs to happen within the lungs. And it's a really powerful antioxidant. And so he had heard about this treatment and had reached out to us because he was obviously, really nervous about having a lung transplant. And he was a fairly young guy, like in his early 60s. And so he reached out to us.
By the way, I agree that is a young guy.
Yeah. Yeah. Yeah, exactly. And he was just like, I'm going to give it a shot. He had never done anything like this before, but at that point he was like, I'm going to try anything I can. Obviously a lung transplant is a big deal. And so he started receiving treatments from us, and slowly he's like, what, I feel like I'm getting better, and we were doing fairly frequent treatments. We were doing a infusion once a week. And he was clinically noticing an improvement, but obviously wasn't totally sold on it. Everyone, in the beginning is like, well, is this kind of placebo effect? Am I just feeling better because I'm doing something? And, but even his wife, every time our nurse would go, she's like, oh my gosh, like he's getting around better. He doesn't seem a short of breath when he, goes up the stairs, like small things, but like to them, it was a big deal because he was in such bad shape. His oxygen requirement was going down. And, so fast forward, he goes to his 2-month follow-up appointment, and, PFTs are like pulmonary function tests. They're a test that basically says like, how good your lungs are doing. They do it for like asthmatics, and in this case, pulmonary fibrosis for him. And he had increased 10% in his pulmonary function. And it was such a significant jump that he was no longer a candidate for a lung transplant. And so he was clinically feeling a ton better. His oxygen requirements were less. And his pulmonologist was just blown away. He was like,
wow.
He actually got very interested in what he was doing because he hadn't seen anything that significant. And he was doing all the traditional treatments and everything else. Right. Like none of that had really changed. This was just something that he kind of took initiative on. And again, that goes back to like people taking charge of their health and exploring some of these alternative methods, which I think is great. Like we need to marry the two. So yeah, he was blown away. He's very curious. He like started kind of doing his own research, and it's like, yeah, I can see how how these mechanisms could work and be helpful. And he continues, he's been with us for 5 or 6 months now. He continues to do his weekly treatments and is doing well. And so, really cool story. That was just one of recently that we were talking about in our manager meeting up in Idaho. So.
That is an awesome story. I'm glad I asked you for one more because that's really great. I mean, to have somebody have that, obvious life-changing situation happen is great. Those are not just bragging rights, but for the patient is just tremendous. So
yeah, absolutely.
I think we can just kind of wind it up right about here. And I think your company really is interesting. I mean, your approach is interesting. It does throw back to another century and in a good way, instead of taking, in today's medicine, we're so much into AI and all these things that are, you have to be careful not to separate yourself too much from your patient by being too efficient. And you guys have taken the opposite approach, but you're bringing modern medicine back to people in an old-fashioned way. And I really, my hat's off to you. It's terrific.
Yeah. Thank you. I appreciate you having me on. We're having a lot of fun. We're loving what we're doing. So it's been a great journey so far.
Well, that about winds it up for today. Thanks for tuning in to The Holistic Entrepreneur. I'm Zane Myers. If you enjoyed this episode, subscribe to our podcast or watch on YouTube. Join us next time as we continue to explore both the art of healing and the science of business in healthcare. We'll see you next time.